We published the largest ever clinical study in ketamine therapy history last year, and that demonstrated that people with anxiety and depression were getting 40% more frequently a greater than 50% improvement in their anxiety or depression symptoms than the predominant treatment, SSRIs or anti-anxiety medicines. So 40% more people were having transformational outcomes, essentially. It was 63% of Mindbloom patients versus 47% of SSRI patients. Maybe just as important if you look at the safety data. And so people who take SSRIs have fairly severe side effects, like 30 to 50% of the time. Weight gain, sexual dysfunction, insomnia, oftentimes severe anxiety, or even suicidality. And sometimes these side effects can persist for life. With ketamine therapy, and specifically our at-home ketamine therapy protocol, people are getting side effects less than 5% of the time, like 1/10 as frequently. And the side effects are a lot lighter. They're like some nausea, sometimes some grogginess, headache, maybe some brain fog for a couple of days, again, less than 5% of the time.
Awesome. I'm live with Dylan Beynon, founder and CEO of Mindbloom. It's awesome to have you here today, Dylan.
Fired up to be here, John.
Did I get the intro right?
It's Beynon, but my entire life has been Beynon. Played football for 12 years, so I'm used to it and don't quibble over it.
When did you play football? Was that in college?
I played football starting at the age of 7, played running back and corner, and walked on to the sprint football team at UPenn, where I went to college and played a couple years until my poor broken back gave out.
Oh, man. Yeah, actually, it's funny meeting someone or seeing them online and then meeting them in person. Uh, you're a lot buffer than I thought you'd be from your photo. You seem yeah, you're pretty compact in a good way.
Thank you. I'll take that as a compliment. I think one of the things over the years I've become grateful for is while growing up playing football, I was playing a little basketball and track, but football was the one I was good at. It was really, really challenging. Definitely built a lot of grit, uh, comfort with discomfort, camaraderie. But one thing I came to appreciate more is seeing people go through their physical fitness journeys as they become adults and see the amount of resistance that a lot of people have to exercise. I think growing up doing that level of exercise is something that I've always like deeply enjoyed. Uh, and so I think I've like looked at people who have trouble working out and be like, what's the problem here? Like, why can't you, get on the treadmill, get out and run, get in the gym, um, and have more recently built appreciation that this is something I love doing versus something that I feel like I need to do and have to like fight through that resistance. So I think that's been a major downstream benefit, a broken back notwithstanding.
Mm, yeah, that's an interesting observation. As I've used the term, I'm pretty addicted to exercise and working out, and then people have like commented on that and been like, well, if it's a positive relationship, is it really an addiction, or is it a something you're just like you've grown accustomed to and is like a positive, is like a healthy
Habit.
habit? I guess it's like when it becomes a little obsessive, and I think that's potentially a good segue, sort of like to the mental health space and what you all are doing in the world of psychedelic assisted therapy. But you had a comment there, and would love to I like when this flows. So what was that?
Yeah, I'm a deep meditator, go on silent retreats. I've read probably about 20 meditation Buddhism books over the last 5 years. Similar to fitness, talk to so many people who want to get into meditation, and the common refrain is, "I know I should." I'm like, that's really interesting. So what you're saying is, in your mind, it's a chore. Like, well, yeah, I know I should. I was like, well, then you're never going to want to do it, right? And so for me, I think about like, how do I sort of build something so that it's no longer a chore, something that I feel like I need to do, and figure out a way to enjoy it and love it, so I feel pulled to it. And so, I see people with the same thing with fitness, where it's like, how do you figure out a way to have a relationship with some sort of, exercise and fitness routine that, to your point around addiction, like you enjoy doing, you feel pulled to. Not doing it is painful. Not doing it is painful. And similar with meditation, I think some of the um, sort of low friction meditation apps like Calm and Headspace, which I think are really great entry points for people. They're generally focused on having people follow their breath for 10 minutes. And that can get tedious and dull and feel like a chore. But if you really get into meditation, you study Buddhism and Vipassana, you see that there's like a skill level to this that feels like a video game or like you're mastering chess or something, where the rabbit hole just goes deeper and deeper and it's highly engaging and engrossing and you feel like you're improving. And so for me, like getting to a point where I was looking forward to meditating every day. If I am not meditating, I'm missing it. It was the trajectory changer.
That's pretty cool. I've been on a little bit meditation of a meditation hiatus, and I would love to get back there. And I'm curious what has like where do you fit it into your day and what it looks like for you right now in order to make it sort of frictionless and seamless for you at this point, or like how is it built into your day?
It's interesting is if you're addicted to fitness, I bet it's not about building into your day. I bet it's like you look for times where, I mean, I'm sure you have a routine. I work out in the mornings generally, but if I can't work out in the morning, I find a time to make it happen because I want to, right? How do I get this into my schedule? I really want to go and do this, right? You don't have to like figure out how to fit eating into your day. Through hunger, develop a desire to eat, make it happen. Uh, and so for me, for meditation, one, I think there's two sort of ways to look at meditation. There's time on the cushion. That's deliberate practice for me, sitting or reclining, eyes closed, practicing meditation, usually about 15 to 20 minutes, sometimes 30, sometimes I'll go, hours. And then there's sort of the real meditation game, which is meditating when I'm not on the cushion, but
Integrating it into your day-to-day experience.
it's not even integrating it, it's meditating. Like it's, and this, I think one of the things that's lost in meditation, something that's a big inflection point for people, is when you actually study a little bit of the Buddhism behind meditation, right? Because meditation is essentially a technology to understand the nature of reality in the way that Buddhism or the Buddha saw it. Insight into three characteristics around reality that that we have these sensations and all our observations in reality are impermanent, unsatisfactory, and they're not us; they just happen. And so studying Buddhism sort of reveals that the goal is for you to be meditating as much as possible, to be aware, to be awake, and not sleepwalking through life. So for me, I'm trying to meditate all the time and observe what's coming up in and out of consciousness and decide what threads do I want to go down versus not want to go down, um, and sort of being more proactive versus reactive in how I live.
Yeah, the other night, story. Like the other night, I was working a lot, like throughout the day. Was hungry. Was looking forward to like having a meal, satisfying meal at the end of the day, and didn't really have much food in the fridge. Made something really quick. Uh, Scarfed it down, and I was probably in a trance. Like I was not breathing at all through this, and then like ate it, and I was like, "What the hell just happened?" My wife wanted me to sit on the couch with her, but I'm like, I am looking at my screen all day, living in the matrix, and I just needed to get up. And like I just went into my bed and just started meditating. And it was like it was pretty cool. Like even though and I was like, wow, I for the last 15 minutes, I did not take 30 minutes, I did not take a conscious breath. And it's interesting to just like kind of live in those two worlds where what you just said around like being living in a way that's meditative versus there actually being this like separation between the time on the cushion and like waking consciousness.
Well, the example you just used is one of my favorite, most frequently used examples. So, if you lived in pretty much any other time in human history, your diet was extremely limited, right? It was hyper local. But now we live in a modern society with a lot of abundance, where you get to eat food that's sourced from all over the world with recipes that have been developed by chefs, really culinary artists over thousands of years. you are a few taps on your phone away from whatever meal you want delivered to your doorstep 20 to 30 minutes later, which, 500, 1,000, 10,000 years ago, that is like God level capabilities. And right, that's heaven, that's paradise. Any food that you want from all around the world delivered right to you nearly instantaneously, that's wild. And most people don't even experience eating most of their meals. They're not there for it. They're not even aware of it. It's going down when they're on the computer or whatever they're doing or thinking in their heads or ruminating. And so for me, when I think about what is living meditatively, one example would be, am I actually there and experiencing, savoring uh, something I'm eating? And so if I'm, not on the cushion, but living meditatively, it might be realizing, oh, I'm eating this really delicious salmon salad, but I'm on my computer, I'm jamming out, realizing that, being aware of it, closing the laptop, and then, eating mindfully. So really focusing on and experiencing all of the flavors and sensations of the meal and savoring it.
Yeah, I promise we're gonna get to Mindbloom. But yesterday I had a conversation with a company called, and I feel like it'd be in your world, and I'm curious if you've had an experience with it. It's Apollo Neuro.
Yeah, I know David
It like
or Dave.
okay, cool. Yeah, it's essentially like um technology that vibrates. So it's basically on your body. So it's essentially sound without any sound, but your body sort of interprets it as like sound in order to get your body into a more meditative.
Parasympathetic state. Yeah.
Yeah. Have you tried it at all?
I have not tried it. Uh, Dr. Rabin, I think he sent me one when I was living in New York, but then I moved to Austin. I don't think it ever got to me. Um, but I know a number of people have tried it who, say great things.
Cool. Okay. All right. Let's get into Mindbloom. So, Dylan, who are you? What are you building? And yeah, we'll start there.
So I'm a three-time tech entrepreneur. I've built three companies that would call mission driven or world positive. My first company is called Voters Friend, one of the biggest voting election platforms in the US. And that was acquired by a company called democracy.com, which was building the LinkedIn for politics for about 10 years. My last company I co-founded is called Mighty. Mighty today is still the leading provider of software servicing and capital for the industry of people who have been injured in car accidents, construction accidents, motor vehicle accidents, personal injury. So we raised several $100 million when I was at that company, including a nine-figure credit investment fund to finance all the lawyers, doctors, and finance companies and patients on our platform. And I left that company about 5 years ago now, 4 years ago now, to start Mindbloom. Here at Mindbloom, I'm the founder and CEO. Mindbloom is the largest provider of clinical psychedelic therapy in the world. We provide at home ketamine therapy for people with anxiety and depression to help them achieve life changing outcomes from their mental health conditions, outcomes that are like 10x better than traditional legacy treatments like SSRIs like Prozac or talk therapy. We have both radically increased access to ketamine therapy from when I started the company by bringing the cost of treatment down 75% through telemedicine, and made treatment available to millions of Americans who didn't previously have access. So we're a fully virtual product that's available in 38 states. And in addition to that, we have built the best clinical outcomes in the ketamine therapy and arguably the entire mental health space by combining the medicine itself with one-on-one and group specialized coaching and specialized therapeutic content and programs, similar like Calm or Headspace in a mobile app, but for psychedelic therapy specifically. And just last year, we published a peer reviewed clinical study along with MAPS, who's doing the MDMA clinical trials, Cleveland Clinic, NYU, UCSF, Houston Methodist, the largest ever clinical study in 70 years of psychedelic therapy history and 20 years of ketamine therapy history, demonstrating that Mindbloom's program has these life changing outcomes that are significantly more efficacious with a 10x lower side effect profile than medications like Lexapro and Prozac.
That's pretty cool. For those out there that don't know what psychedelic assisted therapy is or are not familiar with ketamine, what is it? How does it work? And what does it feel like? Like, what are folks actually experiencing that's giving them these benefits or more positive outcomes?
Ketamine's really interesting. So I think a lot of people are familiar with psilocybin or magic mushrooms, ayahuasca, potentially MDMA, or some people call it ecstasy. Um, and these are serotonergic drugs, or essentially what they do is they attenuate largely your serotonin neurotransmitters, also dopamine in some cases. Um, and these are today illegal, Schedule One drugs, where we are getting closer to being able to provide these to people in a medical setting. Uh, MAPS just completed the last part of clinical trials for MDMA. It's approaching new drug approval with the FDA. Psilocybin's by a couple years out from that. And there's a slew of other psychedelic medicines that are in clinical trial pipelines. So we're probably going to see dozens of psychedelic therapies and emerging neurotechnologies become available to patients over the next 10 years. Ketamine is the only legally prescribable psychedelic therapy that exists today. And the reason for that is that ketamine was first FDA approved in 1970 as an anesthetic and analgesic. Um, and it's been on the World Health Organization's list of the top 100 most essential medicines in the world because it's this incredible anesthetic that is the rare one that doesn't like depress your breathing and your heart rate. So it's incredibly safe as an anesthetic. And so every day in every hospital and ER department in the United States of America, ketamine is being used for people who are coming in for these reasons. About 20 years ago, some researchers at Yale started to see that people who were coming in to hospitals and getting ketamine who had comorbidities of depression were leaving without depression. So that kickstarted a lot of clinical research into the use of ketamine as a mental health treatment. And so the way that ketamine works is it doesn't work on your serotonin system and sort of attenuate it as an agonist like some of these other medicines. It works on your glutamine system as an antagonist. So it sort of cuts off the system. And at really low sub-anesthetic doses, so like 1/20th to 1/5 of what a child will receive in the emergency room every day. It has these psychedelic properties for people that feel like this really dissociative, sort of out of body experience, sometimes with some sort of light shape type visuals or visualizations. It's very emotionally uplifting for people. And maybe most importantly, studies show that when ketamine is taken in these low sub-anesthetic doses, the body or brain will secrete BDNF, or what's called brain-derived neurotrophic factor. People call this like HGH for the brain or fertilizer for the brain. When you secrete or upregulate brain-derived neurotrophic factor, what happens is your brain enters a state of neuroplasticity where it's more easily able to create connections between brain cells or neurons. It's called synaptogenesis. And so when you're having an experience that could feel like a lot of creativity and lateral thinking, cognitive insights, which is really powerful for people paired with the emotional uplifting from the experience, especially people who are dealing with ruminative disorders like anxiety, depression, or PTSD. Um, um, and so people come out of it and they are emotionally in a state that they haven't been sometimes in 5, 10, 20 years. They have sort of activation energy and motivation to make behavioral health and changes in their lives. They oftentimes get cognitive insights into changes they want to make. A lot of people will say this felt like getting 10 years of therapy in just a few sessions. And maybe most importantly, for studies show like 3 to 14 days after any given ketamine therapy dosing, people have this state of neuroplasticity where they're more easily able to rewire their neural pathways, which can show up as new healthier emotional patterns and even like behavioral patterns.
Mm. The industry is definitely showing a lot of promise um, from some of the stuff that I've just watched with like how to change your mind and just kind of following maps and what's happening with substances like MDMA and how close they are to having these sort of medical approvals from the FDA in order to be used as psychedelic therapies or as assisted therapy. And on the ketamine side, with COVID, what's happened with COVID, there's been a lot of companies that have popped up, similar to Mindbloom, but maybe different in terms of their practices that are prescribing ketamine for at-home use. And now there's some articles coming out and folks saying that this stuff is being prescribed irresponsibly and that there's a lot more that we should be sort of wary of or acknowledge before this stuff is like widely distributed and used. Given where you sit and where Mindbloom sits in this space, what are some things for to be wary of? Like, what are some major considerations that we should be thinking about as this stuff, sort of enters maybe not the mainstream, but it enters this world of telehealth? And what is Mindbloom's position in that, and have you all thought about maybe mitigating risk and making sure that this stuff is used appropriately and responsibly?
I think first and foremost, when we look at a medical treatment, we want to look at the actual clinical data around safety and efficacy. And we want to look at existing treatment options and say, how does this treatment compare to other treatment options when it comes to safety and efficacy? So I mentioned that we published the largest ever clinical study in ketamine therapy history, psychedelic therapy history last year. The number of participants in the study was about 1,300. And that demonstrated that people with anxiety and depression were getting 40% more frequently a greater than 50% improvement in their anxiety or depression symptoms than the predominant treatment, SSRIs or anti-anxiety medicines. So 40% more people were having transformational outcomes, essentially. It was 63% of Mindbloom patients versus 47% of SSRI patients. Um, Maybe just as important if you look at the safety data. And so people who take SSRIs have fairly severe side effects, like 30 to 50% of the time. Weight gain, sexual dysfunction, insomnia, oftentimes severe anxiety, or even suicidality. And sometimes these side effects can persist for life. There's like persistent sexual dysfunction disorders that people can have from SSRIs for the rest of their lives. Um, with ketamine therapy and specifically our at-home ketamine therapy protocol, people are getting side effects less than 5% of the time, like 1/10 as frequently. And the side effects are a lot lighter. They're like some nausea, sometimes some grogginess, headache, maybe some brain fog for a couple days. And that's, again, less than 5% of the time. Um, so I think one of the things I would love to see more from the conversation around at home ketamine therapy is actual clinical data on the efficacy and the safety. Because oftentimes what I see is a lot of this feels dangerous. What if it's dangerous? But we actually have a lot of clinical data demonstrating its safety and efficacy. Also, who it's for, who it's safe for, and who it's not for. Right. So, there are definitely populations that this could be a little dangerous for. If you're in an active episode of psychosis, if you have schizophrenia, or even if you have a deep family history of schizophrenia, it could be potentially, dangerous. Um, Ketamine is not physically addictive like alcohol or anti-anxiety meds like benzodiazepams or nicotine. But there are debates whether or not it can be prone to some people creating a psychological dependence on it. Similar discussions around.
Yeah, that's what I've seen a lot of these hit pieces sort of bringing uh, speaking to is that component of it is a lot of like ease of use and dependence, and then I think a lot of like bladder um, consequences on what is it called? Yeah, yeah, and yeah.
Cystitis. It's bladder cystitis. It's like inflamed bladder. Um, Yeah, the bladder cystitis is an interesting one. That's seen in extremely high dose and high frequency recreational users, like people who use ketamine nearly every day in massive quantities, oftentimes for months or years. Um, so we don't.
How much is that usually? Like when you say massive quantities versus, I think, and you had also mentioned at the beginning is like a 30th to 50th of what a pediatric patient would get. Can you give us a little bit on the dosage?
Yeah, it'd be like if you were doing 1,000 Mindbloom programs a year. Like, Like, it's just people who are recreationally doing ketamine, you know, many days or most days a week, and they're redosing over and over and over again. Then it can give you issues with your bladder or your kidney. Um, but it's not something that's seen frequently in therapeutic mental health care settings. Same with psychological dependence. There's not a lot of evidence that indicates, and we track all of this across our thousands and thousands of patients, um, that that there that people in a clinical setting who are using it for their mental health issues are prone to psychological dependency. So that alone is a debate right now, and it's something that people see in some like recreational users and are potentially saying, well, could this potentially be dangerous for therapeutic users of the medicine who are using it for their mental health issues? But again, there's questionable if there's any data to really support that. So I think the first thing is like actually looking at clinical data. The second is with some of the criticisms. One of the things we have been sort of championing throughout the industry is for people to call out conflicts of interest. You know, um, we are often criticized as an at-home ketamine therapy company saying, well, of course they support it. They're an at-home ketamine therapy company, and oftentimes the uh, people interviewed in articles critical have an in-person IV ketamine clinic, or they're like a paid speaker for Johnson and Johnson, the big pharma company that has a formulation of ketamine called S-ketamine, essentially half of ketamine that got FDA approved in 2019, that requires in-person administration and costs 13 times more than generic ketamine. Um, so I think it's important that people disclose their conflicts of interest when they have them, which is most of the people quoted in pieces talking about whether or not at-home ketamine therapy is dangerous. Two, we look at real clinical data and real world evidence around the safety and efficacy of ketamine and at-home ketamine therapy, which tells a story that this is extremely safe, in fact, much safer than SSRIs, which like 40 million Americans are prescribed. Um, and three, it is a medicine that can, if not used correctly and used in a clinical setting, have potential risks and downfalls, right? Like one is that people are very accident prone while they're undergoing a ketamine therapy experience. And if they're not sort of coached up on how to take the medicine correctly, where to take it, we have every client have a peer treatment monitor, someone with them, just in case. We have things like 24/7 clinician call lines in case there's an incident or someone's having a really challenging experience where they can call in and get support. There could be, potential, dangers. So there are a variety of different safety protocols and mechanisms that our clinical team have built in to allow our platform to achieve this incredible safety results and outcomes. We send people like a blood pressure cuff that they are taking on Zoom to make sure they don't have elevated blood pressure because there could be like a risk of a cardiovascular issue for someone who has heart issues because it elevates your heart rate a little bit in some patients. It has to be done well, but the reality is that the data shows that when done, well by a really highly trained doctor with a dialed in protocol and standard of care, it's extremely safe.
Yeah, I think as I've read some of the pieces, something and kind of comes up as you're talking to sort of about the what you all did with maps in terms of the peer reviewed research studies that like people want more research. And I'm curious how, as a founder in this sort of emerging field, are you how does it even look like with the FDA? Like, are you actively in touch with them? Is there ongoing conversation? Are you do you know and how then, as a startup tech and venture backed high growth company, do you think about sort of, hey, we need to do more research in order to make sure that doesn't this isn't prevented in any way by the law. So how are you all navigating the law and the conversations with the FDA, and how do you think things will shake out in the coming months or years? And I know that's a bunch of questions and wrapped in one.
Okay, so I think first, so my last company was in legal, big data component. We use machine learning models to build algorithmic models to predict the outcomes of cases. But probably its core is a financial technology company. And I thought that I knew regulation after working in financial technology. And then getting into healthcare, regulation is a whole different ballgame. We have corporate practice of medicine. There's stuff around HIPAA. You're dealing with doctors' licenses, you're dealing with licensing providers in multitudes of states. There are federal laws around medicine, there are state by state laws around medicine. We're in 38 states. And you're dealing with people's health. There's a high bar of responsibility to do it well and do it right. And as Mindbloom, we're on the vanguard, bringing ketamine and psychedelic therapy to consumers and to patients and people who need it. And so there's also a lot of responsibility that we have as, you know, um, as representatives of the entire space and movement. If we create issues or problems or things don't go well, that could affect the entire cause. So all this to say, regulatory is a major part of our organization and core competency. And we have a whole team behind regulatory and compliance and lobbying and all of that. That said, ketamine is a little different than other companies who have major regulatory opportunities and challenges. So if you look at like Uber or Airbnb, both of those companies were probably the products were kind of illegal, and or at least were in a gray market when they were started. And so they were sort of being really aggressive, getting to market and trying to shift public policy into the future, right, in a way that benefits consumers and in the case of Uber workers, in the case of Airbnb, people who are monetizing their homes. Ketamine is very different in that ketamine was FDA approved in 1970. And so once a drug is FDA approved, that's the FDA saying that this drug is safe for use and it's efficacious for this use that it was being FDA approved. But at that point, doctors are able to prescribe that medication in their best medical judgment, what's called off label, for anything that they believe in their best medical judgment, this medicine can help people for. And about 20 to 25% of all drugs prescribed in the US are prescribed off label. So that means the FDA approved for one thing, doctors prescribe for another. Now there's a spectrum across like super established standard of care and like total quackery, right? Like a doctor's prescribing something they shouldn't for something they shouldn't be. That's bringing patients in danger. And that's why we have state medical boards who are the ones who sort of oversee doctors and how they're prescribing and practicing medicine. So a company like Mindbloom doesn't actually deal with the FDA at all, because this is already an FDA approved medication. If we wanted to run clinical trials to try to get it FDA approved for this indication, so anxiety or depression, which would probably mostly drive towards getting payers to reimburse for it. Right now it's cash pay. We could do that. Um, but really, the regulatory bodies that we're most concerned with that affect our patients and our business and our providers are individual state medical boards. Um, there's also an element of the DEA who is looking at diversion of drugs. So you know the DEA will look at doctors who write tons of pain pill scripts, right? Where people are like reselling them and things like that. But the reality of Mindbloom is that we're prescribing a whole comprehensive therapeutic program that is like 200 times the cost of someone who wanted to purchase ketamine on the black market because it includes psychiatric care from psychiatrists and psychiatric clinicians, a bunch of specialized one-on-one and group coaching, whole
It's more
therapy program.
expensive.
We're a lot more expensive. Yeah. We brought the cost of treatment down about 75% from the average in-person ketamine provider since I started the company. And we've added on a lot of therapeutic support from those providers. A lot of those providers, like anesthesiologists, who just sort of give you an injection, send you on your way. We have real mental health care prescribers and clinicians who are overseeing a whole mental health care journey along with specialized coaches. As a lot of telemedicine companies who have maybe a little bit more of a commoditized medicine they're prescribing, you might go to those platforms and spend, 7 minutes total texting with a clinician to get your medicine. We're spending over 7 hours with every client with our care team going through a 6 session treatment program to get them these game changing clinical outcomes.
Is it really that long? 7 hours?
Yeah, you have multiple psychiatric consults with a psychiatric clinician. There's an upfront consult to get diagnosed with anxiety and or depression to see if you're a good fit for treatment. There are follow-up consults to adjust doses. We do something, our platform does something that's really cool and I think unique, which is you go to most doctors, say you get a prescription for something, say you try it, it's not the right dose, doesn't really work for you. Well, now if you want to change your dose, you've got to like call their office, you get the voicemail, you call them again, you finally get them, they schedule you for like 4 weeks out, you have to go into the office, and then you get the dose adjustment. And like you really have to kind of go out and get that for yourself, right? We take a very sort of proactive, client centric, and personalized medicine approach. Whereas clients go through treatment, they are able to sort of rate each of their 6 sessions in their program. And if their sessions are sort of not where they need to be to get the desired therapeutic outcome, our team is proactively working with them, reaching out to help troubleshoot, like, did you set the right mindset and setting? What kind of came up before treatment? Because things like an animal in the room, phone on, do not disturb, like you jump right into a session without preparing can really affect the experience and the outcomes from it. And then most importantly, is your dose dialed in? So everybody in Mindbloom starts with a really low titration dose, and then over time gets moved up to find the ideal therapeutic dose for them.
Mm. Um, Being in the startup world, experiences are the user experience is consistently being iterated upon and improved. So, where do you think Mindbloom still has left to go in terms of where you would like to see improvements in the experience and the journey? Um,
John,
yeah.
I think it's still day one of figuring out how to apply these neurotechnologies like ketamine and MDMA, psilocybin to help people get the best outcomes possible. To figure out how to match like the right person to eventually the right medicine with like the right dosage and the right support container, the therapeutic content, programs, coaching, therapists to drive the best outcomes possible for people. I think one thing I think that people kind of think that psychedelic therapy might look like in the future is sprinkling talk psychedelics onto talk therapy, and boom, that's psychedelic therapy. But I think we're going to see something completely different, built from first principles around how do you take people through this entire therapeutic and care journey in a way that's going to look radically different. It's called. Have you ever heard the term skeuomorphic?
No,
The
I've heard
skew,
it, but I don't know what it means.
the skeuomorphic is like when there's a new technology and people try to apply it like how the old technology worked instead of thinking from first principles about how that technology is unique. So that's kind of abstract. But an example is the first movies looked like plays. They were like 3 hours long, 4 hours long. There's an intermission. There's like curtain going up and down for a movie theater, right? For a screen. That's like skeuomorphic design. And then eventually we find out actually, movies are unique technology and medium, and there's a way to build movies so they are sort of optimized for this sort of technology. And so when I think of like psychedelic therapy, I think a lot of people right now are thinking in a skeuomorphic way where it'll be psychedelics with some, give psychedelics and do talk therapy. But the psychedelic therapy experience is radically different. And so, for instance, for a lot of people in most protocols, the way Mindbloom works is there's no therapy done during the actual experience. It's, yeah, it's
Yeah, I was going to say that. I was going to say that I think that's a misconception around psychedelic therapy is that you are actually talking to someone while you're undergoing treatment. But in terms of a lot of what you guys do and what other things I've seen is you have the experience and then you're talking to a therapist. I think the only one that I've seen is separate is they do it sort of at the same time as MDMA in terms of the videos of patients that I've watched.
Yeah, they go both. So there's a psycholytic approach where you're giving therapy to someone while they're under the influence. I think with veterans, it's specifically for PTSD, that can be powerful because one of the things MDMA does is really suppresses the ego in a way, like neurologically, where people who have PTSD, this is like real neurological. This is capital T trauma, not lowercase t trauma. It's like real neurological trauma that's caused by this traumatic event, where their neural pathways are unhealthy in certain ways, right? And so they're then able to actually engage with that traumatic behavior, sort of process it, make sense of it, come to terms with it, and figure out how to integrate it afterwards. Um, but a lot of psychedelic therapy providers and protocols, including ours in Mindbloom, is very non-directed. So there's the preparation for the experience. So Mindbloom patients and clients will write out their intentions for the experience to prime their subconscious. And we give a bunch of different prompts and tools to do that. Then there's the experience itself, where the goal is to actually collect experiences as they come up. The goal is not to like analyze during the experience, but to have the experience sort of observe it and be aware of it and collect these things. And then afterwards is the integration of it. So that's where you're really trying to interpret and make sense after the fact of what came up during the experience, figure out what you want to do about it, like what changes you want to make in your life, and then leverage that neuroplastic window to actually make those changes in your life so that these new neural pathways are developing really coalesce and stick.
Cool. And then in terms of just the experience itself, the Mind Bloom journey, um, you go through sort of like a telehealth online experience. You see a psychiatric nurse practitioner or a psych PA, or a psychiatrist in order to make sure that you're the right fit. And then first dosage is sent to your home with some of the appliance, with the things that you mentioned, the heart rate and blindfold. Yeah.
Yeah, we've got these Bloom boxes. I saw in an article recently, someone called it a cute little suitcase. I thought they nailed it.
No, they're nice. And then you schedule your first session. You see a coach before and after the session, and then the rest of your, I think it's another 5 treatments. The medicine is sent to the patient, but those are self-guided, right?
Yes. So after the first session, where your guide, which you select, right, from a list of, I think, over 120 guides now on our platform, you do that first session with them so they can teach you how to do it. Because there's a real skill set to doing ketamine or psychedelic therapy. The difference between doing it really well and not doing it well is a massive difference in the likelihood you'll have a positive experience and get something out of the experience. Um, it's a learning curve. Then they also meet after to help people and guide them on how to integrate. Um, and then after that, people can do their own sessions on their own time, but they can also meet with their guide one-on-one in integration sessions. In a group setting, we call them integration circles, where you share your experience with other clients who've gone through it, facilitated by a guide, which are incredibly powerful. Um, Downstream of a lot of experiences I've had in ayahuasca ceremonies where I've done that, where I thought something like that I wouldn't enjoy, but it's incredibly effective and powerful. And this gets to your question around what am I really excited that we're going to be building in the future. We have a lot of different therapeutic programs for people for different mental health sort of issues or challenges that contribute to their sort of mental health problems. And so these are different guided audio sessions for sessions. right? So like when you do your session, it's an hour, about an hour, 45 minutes to an hour and a half, headphones on, eye mask on, really going inward, laying down. And we have different guided audio and music to help guide people on their journeys, to help bring things up for them and give them positive experiences. We have a lot of content to help people, like I said, set their intentions before, journal immediately after, and then a lot of integration content for between their sessions to help them get different sort of evidence-based piece of information and topics on the mental health care issues they're going for, and really help them create an integration action plan so they can make changes in their life and not just have these experiences and hope that they get better. And so one of the things I'm most excited about, over the next year or two, is we're building out, the largest, called library of really specialized programs to help people with their mental health issues and opportunities using ketamine therapy. So think building, one of the world's best ketamine therapy programs for couples therapy, for eating disorders, for excessive drinking, for smoking cessation, for grief, for loneliness, for career purpose. Um, the list really is endless of different things that can improve people's mental health or different things that people are grappling with in their lives that are contributing to mental health issues because our whole lives are dynamic, right? Like one moment you're good, the next you have a death in the family. I've been seeing this myself. A big reason that I started Mindbloom, in addition to psychedelic medicine being transformational for me for over 16 years, is that I grew up in a family that was obliterated by mental illness. My mother was schizophrenic and an addict. My sister was schizophrenic and an addict. My mother spent 15 years homeless before dying of a fentanyl overdose about a year and a half ago. And my sister would have been homeless, but my dad housed her, and she just died of a fentanyl overdose several months ago. And so my dad has been going through a really intense, deep, disabling depression. He was unable to leave his bed essentially for 20 days straight. Deep grief, and recently, was able to get him treatment, and he's now back on his feet. But we don't yet have a grief program, and so we're going to be building stuff like that so that we can really help people tackle the issues that they're having, while going through ketamine therapy treatment and getting that emotional uplift, cognitive insight, neuroplasticity to get through this stuff and heal and grow faster.
Wow. I'm really sorry to hear that. That's really sad. You've gone through that. And it's I'm glad you brought that up because I was going to actually ask sort of about your background and experience, firsthand experience with psychedelics, and then how you have since incorporated them into your life. Do you plan them on your calendar at the beginning of the year in order to make sure that you have some of these peak experiences? Do you sort of just check in with yourself daily and understand when you sort of need to shake the snow globe a little bit and go inward? And now that you've had experience also with different substances in this world, how do you decide which to go with and why?
So as you mentioned, psychedelic medicine has been transformational for me for 16 years now, and I've used a lot of different medicines. And different medicines have sort of different purposes at different times. Some resonate more with me than others. Some that haven't worked as well work later, vice versa. Today, I mean, one is I'm a patient of Mindbloom. So I do Mindbloom, at least every month. And that's been incredibly transformational. Uh, Ketamine specifically, we were talking about meditation earlier, like ketamine specifically, this is a clinical viewpoint. By the way, for this whole conversation, I'm not a doctor, not a clinician, just a tech entrepreneur, psychedelic medicine patient, and overall advocate of these medicines. um, but ketamine pairs really well with meditation, more than any other psychedelic medicine I found, uh, because it creates a little bit of an out of body experience. It pits people feel like deep back into their consciousness where they're able to really get present and observe. Whereas other psychedelic medicines can really enhance your senses meaningfully. like LSD or mushrooms or ayahuasca, to the point of intense distraction. There's a lot going on. Ketamine cuts off all those senses and creates that out of body experience. So I've found that it's really deepened, my meditation abilities and skills and practices in a way that's really stuck with me in my daily life. And so that's been really meaningful. I get a lot of, like I mentioned, like emotional and cognitive, you know, emotional uplift and cognitive insight, where I feel really revitalized and refreshed afterwards. Um, I also, therapeutically, you know, go to, ayahuasca ceremonies and other plant medicine ceremonies, probably 2 to 3 times a year, um, which helps me, and that's more of like a long weekend, and that helps me really go inward and explore the things in my life, the ways I want to be, and help me make some big changes. You mentioned shaking the snow globe. I think that's a great analogy. And sometimes there are specific things I want to work on. Um, you know, um, Maybe there's like like habits that are unhealthy that I really want to break. Maybe there is some way of being that I really, or experiencing or feeling that I'm missing that I really want to try to explore and to encode. And other times it's more, open ended, like want to see what the medicine can show me and see what I'm missing. And see what I'm not seeing.
Yeah, I was going to ask you about that and whether you think people always need to. Obviously, we've talked a lot about the clinical environment and things like anxiety, depression, PTSD, but this whole idea of I've heard Michael Pollan talk about it, is like the betterment of well people is like even high performing folks, employees, people at companies, leaders. Um, we're all dealing with some level of maybe lowercase t trauma, as well as anxiety and compulsions, and whether there's also a benefit for folks that may not be dealing with an anxiety or depression. I don't know if Mindbloom is making its solution accessible to those folks, but whether they could also benefit from these mind altering compounds and consciousness expanding experiences.
So two things. So philosophically, I'm not a huge fan of that dichotomy between people who are mentally ill and then the betterment of the well. Michael Pollan's a genius and an absolute trailblazer and has done a tremendous amount for the cause for both psychedelics and overall mental health, right? So I'm not lambasting or criticizing him, but that is a common dichotomy I hear. There's people for the sick and the betterment of the well, and I think the reason I don't like that is that it fits into an what I call an old medicine paradigm. Like old medicine is very reactive. It's waiting until you're sick and symptomatic and injured to work on your health. It's very sort of like called like patriarchal or parental, parochial, yeah, parental, where it's like waiting. Like you go to a doctor and they tell you exactly what you're supposed to do. Like you're not in charge of your health. Somebody else is in charge of your health for you. Like you're not the one responsible for it. Um, and I think instead we're starting to move towards a new medicine paradigm that's a lot more proactive and not focused on treating symptoms and diseases, but how do we make you the healthiest version of yourself possible? So, physically, emotionally, cognitively, spiritually, or ontologically, like how do we really get you as healthy as possible so you can both live like a more fulfilling life with more vitality, but also show up for the people around you as a better person and potentially leader, right? How can you be better for your friends, family, community, and the work you can do in the world? Um, an analog is like, should we wait until someone has diabetes to get them on insulin, or should we get people as healthy as possible down with diet and exercise so that people don't get diabetes in the first place?
Mm, yeah, that's a great point.
Right now, ketamine therapy can only be prescribed for a clinical, indication based on this, pre-established standard of care. I think a lot of people are surprised though how much they can qualify for mild anxiety, especially. in today's society. So I think we've like normalized the idea that like if you have some trouble sleeping and you're really restless and you're like a little anxious, that's like normal, but it's actually not normal and not healthy. Right? You're like, yeah, I worry, but like just as much as everybody else, like that's actually not healthy and that's not optimal health, right? Not optimal brain health or behavioral health. Um, I think a lot of people end up qualifying for mental health treatments, including ketamine therapy, but also other mental health treatments, um, even if they think that they're not, mentally ill or sick, because there's still a lot to work on. But would like to see and expect us to see and predict us to see a evolution where psychedelic therapies, because of the efficacy, because of the safety, especially, uh, where it becomes an established standard of care to be completely elective, and people don't need to get a clinical, diagnosis in order to be qualified for treatment.
Mm. How have you, as a founder and as a leader, thought about mental health in the workplace? You startups like what is it, the slogan is like move fast and break things. Sometimes the most health and wellness oriented companies in terms of their product sort of lack the know-how of like making sure that their people are taken care of and that they are also supported, and that their cups are full in terms of what they're providing to the market. How have you thought about those things? And yeah, I'll keep it at that.
I heard a quote recently. It was attributed to Sean Parker of Napster and Facebook fame. That maybe roughly paraphrased was, startups are like eating glass and learning to like the taste of your own blood.
That sounds intense. Yeah.
In those senses, like I guess he makes you. I guess he's positing that startups make you a masochist, right? Um, um, so how do I think about mental health building a company? So we actually have, um, when I went to undergrad business school. I went to Wharton. Mostly skipped my classes and read books, but if you told me at that time that I would be building companies in the future, I'd be like, oh, sick. That's why I came here. If you told me that I would be building companies in the future and that I would spend a lot of time studying, deliberately practicing, and implementing company culture, I would be like, wait, I thought that was totally BS. I thought that was like a poster in the coffee room, right? But company culture is incredibly important, right? Like coding your company in terms of here are the core behaviors that we're aligned on, how we do things around here, and ergo, here's how we don't do things around here. Can be this incredible force to create, not just a fulfilling workplace, but a really effective workplace that is better and more equipped to achieve your strategic goals and objectives. And so I look at culture through a few lenses, but maybe the primary one is a set of core values. And these aren't just, things we talk about. For each of our core values, we have rituals, like artifacts and mechanisms that are encoded into the company's operating DNA, such that if I get hit by a bus one day, the core values have no chance but to live on because it's literally how everybody works here. And so our four core values are to, one, practice intellectual honesty. So we have a really innovative feedback culture. We actually just won the Tony Hsieh Award for having a really innovative, transformational company culture. I've got a little pewter sneaker behind me. Here's the trophy. And one of the things that they called out was that we have this really innovative feedback culture, where people are giving appreciation and constructive feedback in a mechanized, very direct, but with positive intent way. Um, that's one aspect. And so, sort of along those lines, I'm a big believer that if you can get rid of politics where people say the things that will get them an outcome they want instead of saying the things they believe to be true, you can create a really fulfilling, sort of less, Machiavellian or unclear workplace for people. And it starts with hiring people who can fit into that culture, people who are low ego or inquisitive, and, sort of are, we call emotionally developed or mature enough to engage in difficult, challenging conversations with, a high degree of skill, but also, sort of understanding that, you can do it with positive intent.
How have you formalized that? Is it like is it a form? Is it a like kind of like a performance review?
Mm. So we actually, they actually, if you watch the presentation at the Masters of Scale conference about us in the Tony Shea Award, one of the things they called out is we actually don't do annual performance reviews. We killed the annual performance review. I find those to be incredibly soul crushing, right? At the end of the year, you need to give 40 reviews to everybody, have fun. Um, and so instead, we do a few things. Um, One is there's a book called Thank You for the Feedback that I think is very solid. It's actually, yeah. And there are like three types of feedback. There's appreciation feedback. Here's what you're doing well. There's coaching feedback. Here's what you can improve on. And there's evaluation feedback. Here's where you stand. It's important to give people all three types of feedback and understand what feedback people need. And so what we do is we have this 2 week meeting system, again, encoded in the DNA of the company, where first week, everybody comes in the leadership team meeting and they have their department team meetings before that. Um, and we have about 350 people at Mindbloom now. So every single person in the company is doing this, where people bring their commitments for the next 2 weeks, their commitments from the last 2 weeks, and did they hit them? Yes or no? And if no, what happened? And what's going well, not going well against key performance indicators and objectives and key results, or essentially goals for the quarter. People bring discussion topics. Everyone reviews the document ahead of time, adds comments, and then we start the meeting with some connection question, usually a connection question. Just kind of gets a vibe out as a team, and then we review the comments and then talk discussion topics. And then the next week, while we're working on that 2 week sprint, we have a feedback meeting where everybody brings I like, I wish, appreciation, constructive feedback for their manager and for at least one peer, although people usually bring more, and then all the feedback they got from their team. So if you start at Mindbloom today, you can see now 4 years of written I like, I wish feedback that every single person at the company, including me, has gotten over the past every 2 weeks for the past 4 years. Um, and so as a result, there's this steady stream of feedback. So we don't have to do annual performance reviews because we've been giving feedback the whole year. And then we have like a basic evaluation scorecard that people sort of update as needed and talk about their team as needed to let them know, where they stand. But it's very sort of concise, high level. It's like performance A, B, C, D with a little rubric around sort of performance and then our core values, and then like one area that you can improve that you're going to be coached on.
Cool. Thank you for double clicking into that.
Um, yeah, we go through the other core values. They're make exceptional decisions, focus, and the last one's cultivate wholeness. But to your question around how I think about mental health, our core value of cultivating wholeness is about creating company culture where people can be human beings and where positivity is celebrated. We have a core value around intellectual honesty. And as I just mentioned, we give a lot of really direct and candid feedback, but it's with positive intent. And this is feedback designed to help you improve for you and for our clients and for our mission, not feedback to admonish you. And if someone is criticizing or attacking, that gets called out as feedback as well. Um, so, we have a bunch of stuff that we do around like shout outs. So every day people at the company in our company wide channel, 350 people, are shouting out other members of the team for contributions they've made to help us achieve our mission, stuff they've done that's really badass. We celebrate client stories. So every day, tons of transformational client stories from our clinicians and providers are shared with the whole company. Um, and a lot of other mechanisms to make sure that people are able to be their authentic selves, and we have a culture that's positive.
That's amazing. Um, Dylan, last few questions as we wrap up the conversation. I'm curious where you sit in the industry, sort of being working both in tech, having started a couple companies, and then also like in the digital health psychedelic assisted therapy world. Um, what's most exciting for you right now outside of Mindbloom? Whether it's companies that are being innovative, brands that you're seeing, what do you get excited about outside of the core business?
One of the things I'm really excited about is, so I think we're going through this really interesting, um, like cultural, familial, like residential transition period where our ancestors on the savannah lived in like 75 to 150 person tribes and clans, right? So you had this extended family, this extended tribe. In modern society, we sort of atomized into these nuclear family units. People lived in cities, they worked, they moved to the suburbs, they commute back into the cities to work, they raise their families in the suburbs, their neighbors are generally complete strangers, roll the dice. I think that was always very broken, right? But it really started breaking when people started moving away from home. People started going to college and living in different cities, and they're far from their extended family. So now you don't just have this atomization in suburbs, but you're kind of where you grew up. But now people are all over the place. So people are really disconnected. I think there's all kinds of reasons for the mental health crisis beyond that. We need better treatments. There's like people feel disconnected from meaning and purpose, disconnected from potentially like spirituality, which isn't what it used to be. Maybe that's why people are so religious about different like political and cultural things. People are disconnected from a sense of purpose in their work, but I think people are also really disconnected from a sense of like family and friendship. They don't have sort of social ties that our ancestors did. Um, and so now with remote work, people aren't even commuting into these cities anymore, right? People are working from home. Here I am. um, and so I am really excited about, for lack of a better word, like next generation, like community, where people are finding new ways to live and work, where they're surrounded by people in a really tight knit community that looks a little bit more like a tribe or a clan, where people can like really like raise their children together. I don't have them yet. We're raising embryos at the moment, but all of my kids are starting to have kids, and my wife is actually head of engineering here at Mindbloom, and I are probably a couple of years away. And so to that end, we were living in New York City for 10 years and moved down to Austin, Texas 2 years ago. And the big driver was to try to build sort of a V1 living community, anti-commune commune, like whatever you want to call it. And so we picked a neighborhood right south of downtown here in Austin, have about, call it 10 friends who have all bought houses in the same neighborhood. Sort of our V1. We got a house right next to two of our best friends here. And we're combining front backyards, and beginning on to work on building this really tight knit community where you look left and you look right, and all the people around you are family, close, friends. Um, and so I know that this is sort of an emerging conversation. It feels a little fringe to some people, but I'm seeing it pop up in different places. And this is this sort of movement towards rethinking how we live and work in tighter knit communities is something I'm really fired up about.
That's pretty cool. And I love that you also brought it back to sort of what is behind the mental health crisis, and not necessarily focused on the symptoms, but a lot of it is the lack of community and the lack of connection and loneliness.
Yeah, there's a book called Lost Connections um, that I am a huge fan of. It's my favorite book on mental illness. The author started investigating treatments for, I think, his own depression, and started to learn that the clinical efficacy of these mental health treatments is stunningly low, but nobody talks about it. We assume talk therapy works. We assume SSRIs work, but they don't work for enough people. I mean, the clinical data is really, really bad. Talk therapy, the clinical data shows, is no more effective than a placebo. That's something like 5 to 10% of therapists drive outcomes, but 90 to 95% of therapists don't. There are therapists out there that really drive outcomes, but a vast majority don't. And most therapists that do are incredibly expensive. Um, Not all of them. Obviously, there's some great people out there who are doing great work for people. Um, but he discovered that kind of a secret in the psychiatric mental health care communities that people graduate from medical school, or they get their LCSW to become a therapist, and they think they've been given like a robotic arm and a scalpel for surgery, but they actually have like a hammer and chisel. um, we're still like in the Stone Age here when it comes to mental health treatments, kind of treating people with like mercury bloodletting leeches. Um, and I thought that book was really great because he really digs into some of the, to your point, root causes that he postulates that I buy into around it. Not just how do we treat it with pharmaceuticals, which is also why. Yeah, go ahead.
I was actually going to get into the last section of the conversation, which is the rapid fire. So you hit your uh, maybe book you've recommended the most or reread multiple times, or one that has left laughed. I'm stumbling over my words. Has left a lasting impact on you. Is there any others that you'd want to mention?
Yeah, there's a book that we give. We have two books to every new Bloomineer here at Mindbloom. Um, One is the 15 Commitments of Conscious Leadership. I'm a huge fan of this book. Obviously, we give it to every employee, and they are required to read it. Um, to me, it's like a book that combines um, company culture, how to build a strong company culture, and really behaviors within a company culture with like really effective communication, a little bit of like sort of spiritual, like sort of conscious principles. That's absolutely incredible. That pretty much everybody reads, really buys into, and we've been able to like rally the org behind. And it'd be valuable. Just it doesn't need to be for work, right? Just as a human being going through the world. That's something I can't recommend enough for people who want to grow emotionally, psychologically, and their effectiveness of relating to others.
What was the other book?
The other book we give everybody is No Rules Rules. It's the Netflix culture book, um, which a lot of the company culture I'd already built aligns a lot with the book. So I think one, just align with how I build companies, and then two, I think gives a lot of reasoning and examples behind some of the things we do.
Mm. I also really like it's a book about by from Netflix's chief talent officer, Patty McCord, called Powerful. That's great sort of on their culture as well. Do you have a purchase under $200 you've made in the last 6 months that's provided a lot of value to you?
You know, um, this is such a bad answer. I used to get, I have like my own formulation of a uniform, right? I wear like, but I try to make it like a little, unique in that I have like one style and pair of every item. And then I have that in like different colors. And I was getting these V-necks from Calvin Klein for a long time, and they just like slightly m- modulated the style, and it just didn't fit the same. And so I was looking for a new V-neck that I could just buy this V-neck over and over and over again for like 2 years. And I finally found it. They're these David Archie white and black, like micromodal and bamboo rayon V-necks on Amazon. And it's literally my whole closet is just these V-necks. And so
That's funny. Now that you say that, I'm like, I think you were wearing the same thing when I when I saw you. Yeah, reduce the cognitive, decision load in order to focus on other things. Is there a signature dish you make or favorite thing to cook?
I think this wouldn't be under $200, but one of the things I started doing recently, which sounds expensive, but is actually quite affordable, is hiring a chef to do weekly meal prep. So I get like a whole week of meals, like 3 dishes of healthy proteins, like one big salad, two other big vegetable dishes, delivered to me like once a week from like a private, chef. And I actually probably save money on food that way from like ordering on apps and paying, restaurants and delivery fees. And then I always have, super delicious, healthy food in my fridge so that I'm not even snacking. Like I'm just eating actual whole food meals.
That's smart. Yeah, because if you can get someone to clean your house, just say for $150 or so a day, and you buy all the ingredients, and they can make the food, that that's the same.
Yeah, well, it also improves my health, right? I eat healthier because I do that. I get to control the ingredients, so there's no vegetable oils, no sugar. You know,
Speaking of, is there something that you always have stocked in your pantry?
maybe a more interesting question is what I don't have stocked in my pantry. So I don't have any snacks in the house whatsoever, like any unhealthy snacks whatsoever. If I have them, there'll be a moment of weakness, and then I will become a glutton and just engorge myself on them. um, my partner in crime, Allie, who I mentioned is the head of engineering Mindbloom, she still likes some snacks. So there's this there's this constant game where she's hiding some snacks somewhere in the house, some like Kind bars or dark chocolate, like with some sugar in it. Um, and at some point, I'm gonna go some mixed nuts, right? Because I just I'm gonna engorge myself on the entire box or bag if I eat it. So sometimes she'll find me and I'm just like looking for her snacks, like trying to find where the snack hiding spot is. And sometimes I'll find it and she'll have to like move it. Um, but no, the snacks I have are like horrifying snacks like canned sardines and salmon and that's prob and protein shakes. Those are my snacks I eat.
Did you two meet through the company or did you know each other before?
We're old school. We met on the street in college.
Oh wow, so you've been knowing each other for a while.
Yeah, we met in college and have been living together for about 12 years and got married a few years ago. Um,
Wow, amazing. I might know the answer to this, but one thing you're grateful for today.
yeah, she loves working with me. People always ask, "Do you like working together?" And I was like, "Yeah." She's like, "Ah." One thing I'm grateful for today, um, might be kind of I don't know if it's a cop out, but I one of my mental health routines or practices is I have a handful of like psychological techniques that I use, which are essentially habits where like there's some sort of trigger and this where meditation comes into place. I'm mindful that I'm feeling a certain way and that triggers me to be like, whoa, I need to zoom out and have perspective. So, like, okay, let's say I'm like stuck in traffic, right? Which really happens. I work from home. If I get stuck in traffic, I'm like, oh, this sucks. Getting in traffic. Why did I schedule my doctor's appointment at 5 p.m.? Like, I'm an idiot. I should know better. And then I realize, like, whoa, am I like, I'm like, I'm born. I'm gonna die. I'm gonna have a bunch of experiences in between. And each of these experiences, each like little sensation I have, thought, emotion, everything has some degree of valence. It's either like like very pleasant, kind of pleasant, neutral, not very pleasant, like torture, pain. Um, and right now, I'm experiencing like negative valence over nothing, right? Like I'm just like ruminating on it. And so when I realized that, I'm like, zoom out, and I zoom out and think about all the stuff I'm grateful for, right? Like, I'm grateful I live in a time and a place where I have an automobile. I'm not like, walking barefoot down like a cobbled road. Like, I'm grateful that I have a Tesla. I'm grateful my car's driving itself in traffic right now and I'm the one driving. I'm grateful that I'm listening to this incredible podcast while I'm in the car. Like, I'm grateful that the car is climate controlled. I'm going for my house is climate controlled. Like, like how lucky am I? Like, how good is life when you have some perspective and can like appreciate those things. Um, so to your question, like every single day, I'm catching myself doing that, right? It happens over and over and over again, and zooming out and thinking about how lucky I am and how grateful I am to be alive, the time and place I am, the relationships I have, the work I get to do in the world. Yeah, I still have a lot of problems and stuff, but that's probably one of my number one mental health routines or psychological techniques is that sort of gratitude flip.
How about the best piece of advice you've ever received?
I don't think this is the best piece of advice I've ever received. We're talking about No Rules Rules a little bit earlier, the Netflix book. And one of the core, this is something I've just been continuing to like think about and really push on. One of the core themes of the book is called talent density. The story is that Netflix was going through some challenges and they had to lay off a lot of people on their team. And a lot of people on their team they were laying off, they thought were like good. And they weren't exceptional, but they were good at their jobs. And they're like, we're going to lay off these people who are good, who we need, and it's going to suck. And it's going to be really painful in terms of how the company is going to perform afterwards. obviously laying people off is always sucks. It's really painful. Then they laid off the people who were good, and then the company just accelerated. And the learning, which you kind of only see firsthand, is that the gap between great talent, and this isn't anything, this is product management and engineering, when you go to your doctor, right, you go to your physical therapist, like really in most fields, the gap between great and good is massive. And the amount of people who are great is very, very small. Um, it's like when I'm coaching up my managers, um, one of the big things I see in terms of early management mistakes for people is they spend a lot of time trying to help good people become great, which is very hard to do and takes a long time to do. And if it can be done at all for most people, instead of spending more time finding people who are great. And it's the same with like, say me, if I'm going to like a doctor, like I should spend a lot more time, say I'm working on like gut health. I should spend a lot of time finding the great doctor, um, who is, actually like goes to conferences and reads and is on the cutting edge, not just is practicing what they learned in medical school, in sort of a rote, turnkey way, which is what obviously a lot of doctors do. And so I'm thinking both about how to keep that cultural principle throughout our company, especially as we grow and scale, and also how to apply it in my life to all the people that, I work with, day to day and anything I'm doing, you know. So that's advice that I've gotten. It's advice you get, but until you see it, you can't really see it. Um, but yeah, it's something I'm thinking a lot about.
Okay, last two. Who do you look up to and why?
I'd say like germane to this entire discussion around psychedelic medicine. Um, I said germane to this discussion around psychedelic therapy medicine. One of my heroes, his name is Alexander Shulgin, or was Alexander Shulgin. He's often considered one of the godfathers of psychedelic therapy and psychedelics. He was a researcher who was researching psychedelics and synthesizing them, and he caught wind that they were going to become scheduled by Nixon and outlawed. And so before they became illegal, he published a book called, he has two books, T-Call and P-Call. Tryptamines I've known and loved, it's like class of, tryptamines are a class of drug like psilocybin, LSD, and phenethylamines I've known and loved, which is a class of drugs like MDMA, 2CB. That's like one part love story about him and his wife, and then one part like kind of chemistry cookbook, trip reports that lay out how he would synthesize these drugs. He would take them for the first time, this new drug he had synthesized at really low doses, and titrate up the dose, um, until he got effect. And then he had like, a group of friends where he would have sort of groups and parties where people would come over and try these for the first time ever synthesized drugs. Um, and really sort of propelled the space forward. He's one of the early people to like synthesize MDMA, for instance, 2CB, and hundreds of other molecules. And so one of the things I would look up to about that was one, um, sort of the the overall courage to sort of follow his bliss and to take these medicines himself, and not just through like a traditional research setting on animal studies, but sort of self experiment and trust him, and then the courage to publish these books and get his work out there because he deeply believed and knew that these medicines were good for people and that people needed to know about them. That makes him, I think, a warrior of the cause. Um, and then two is that level of like creativity that he was able to bring to his work, um, and how much that work was like integrated into his life, like integrated with his wife, with his peers, with his community. To me, it's just like an all-time story, an all-time contribution that I really admire and respect, and has obviously meaningfully affected my life and my path.
Yeah, it's awesome individual. Uh Legendary. Uh I'm gonna swap out my last question for a new question that I'm curious about to experiment with, which is what is your least favorite piece of health advice?
I think most health advice is hacking at the branches and not getting to like the root cause issue that I think many of us have when it comes to different aspects of our mental health. So a lot of mental health is advice or prescriptions. Do this, do that. You should do this. You should do that. But to me, the root of a lot of health things is making that thing a non-negotiable top priority for you. So, for instance, like I have had some like maintenance insomnia in the past several years, and you can give me all the advice about it. Take magnesium L3 a day, track your sleep, which didn't work for me. Cool your room, etc. But at its core, like it's taken me a long time to get to making sleep a non-negotiable top priority for me. Because the thing that's been most impactful has just been like reducing my caffeine intake 75%. Right. And so if it's a non-negotiable top priority, like then I will take on all of these different experiments and things that I could try and I'll implement them and I will like focus on it. But until it's not, then I'm not going to really do it. I won't do what it really takes. And I see the same thing when it comes to like with a lot of founders, this comes up with mental health. People are like, oh, I really want to be less anxious and stressed. And it's like, okay, well, are you willing to make your mental health a non-negotiable top priority or your kids a non-negotiable top priority, whatever it is? And they'll be like, yeah. So it's like, okay, so you'll work like 2 hours less a day. Like, well, I can't do that. Okay, that's not a non-negotiable top priority. That's okay. That's okay if you want to make that trade-off. But I think getting clear on what your non-negotiable top priorities are and what's not, and what do you want to make one, to me is like one of the most critical foundational mental health like habits or prescriptions or advice.
So I think I've hit a record, Dylan, in terms of my time with you. I feel like we could keep jamming for a while, but I want to be respectful of your uh, non-negotiable priorities. And it's been a lot of fun diving into the what you all are doing. You know, the intricacies of and nuances of at-home ketamine treatments, your own personal philosophies and views on health and wellness. Last question, I just want to throw it back to you. Where can people learn more about you? How can people learn about or get started with Mindbloom? Anything else you want to leave us with before we sign off today?
Uh, yeah, you can find Mindbloom at mindbloom.com. And I, as part of my mental health routine and practices and prioritization, am not a on social media posting. So the best place to find me would be to follow me on LinkedIn, which is as old school as that sounds.
Yeah, you do some good posts on LinkedIn. Companies signing up for Mindbloom for their employees is another area we didn't really get into, but I guess you got to follow Dylan on LinkedIn to see the latest and greatest. Appreciate your time today. It was a lot of fun, and thank you for the work you're doing.
Thanks, John. Had a blast being on. Appreciate it.